Hey guys, thanks for joining. What will hopefully be a very quick and painless refresher on what some seizures look like and how to recognize and observe a seizure when you see it happening. I'm Nurse Amanda with the Lab Collaborative Program over at the Arlington High School. And let's go ahead and get started. Today we're going to talk about how to observe a seizure. I'm going to share my screen with you guys. Here we go. All right. Here we go. If it ever loads. All right. So, what is a seizure? Really quickly. A seizure is a sudden, uncontrolled electrical disturbance in your brain. It can cause changes in your behavior, movements, feeling, senses, and in levels of consciousness. Having two or more seizures within 24 hours apart is usually connected to the diagnosis of epilepsy. So, if we have students, we have kids who come to us with an epilepsy diagnosis or a seizure disorder diagnosis, one of the important things for everybody to know is what do those student seizures typically look like? And then, if we see things that seem like seizure like activity, it's important that we notice those and that we document those, we write those down, and we reach out promptly to medical providers so that we can let them know what we're seeing with that student. Um, let's see. Let's talk about a couple of different things. There are a couple of differentiations with terminology. So, one thing you will hear described in names of different types of seizures are focal or generalized. Focal just means that it's happening in one specific part of the brain, whereas generalized means that the seizure activity is happening in different parts of the brain. Sometimes focal seizures will be completely one sided. Um, so if you see a kid who's doing things over and over again on one side of their body and not on the other, that might be something to kind of pay attention to. Generalized seizures could be one sided, both sides, or could start as one side and then generalize to both sides. Um, let's move forward a little more quickly. So, one of the big things is that a lot of times when we talk about seizures, people are familiar with the idea of a tonic clonic seizure because that's what they see on television shows or in movies. These are the big seizures that a lot of times result in a loss of consciousness, um, clenching, unclenching of arms and of legs. So there's a tonic phase and a clonic. Tonic just means stiffening. Clonic means relaxing. A few things that might happen here. All the muscles might stiffen. Air might be forced past the vocal cords. So somebody might kind of cry out suddenly. They might lose consciousness and fall to the floor. Sometimes they accidentally bite themselves in that clenching of their jaw. And then comes the clonic phase. The arms and the legs might jerk rapidly. There might be a rhythm to them. Sometimes the hips might lift and the back might arch. And then after a period of time, the jerking would stop or slow. If seizure activity lasts for a long time, somebody's face might turn a different color, blue or gray. Or their face might turn a different color because their respiratory muscles, the diaphragm, is having a hard time working and their body is not breathing the way that it should be. So, some things to watch for and notice if they happen, if somebody's face changes color or if you're seeing bluing around the mouth, those are signs of a seizure that is an emergency because that means that their body is not getting enough air at that time because their breathing has been compromised. Oftentimes, when somebody has a tonic clonic seizure, they will lose control of their bowel and bladder as their body relaxes, and the awareness or consciousness will likely return slowly. Tonic clonic seizures normally last between 1 and 3 minutes, and then afterwards, people can be confused, irritable, depressed. They will not seem like themselves. Sometimes students will throw up immediately after. Any seizure that lasts longer than 5 minutes needs immediate medical help. A seizure that lasts more than 10 minutes or three seizures in a row without the person coming into consciousness between them is a dangerous condition, status epilepticus, and you would be going to the hospital. A seizure longer than 5 minutes, you would be going to the hospital for our lab policies. So that's typically what we think of when we think of what is a seizure, okay? So here is a nice little graphic. I'll send this out to all of you guys with the slides. These are some things that we tend to associate, right, with a seizure. Somebody might be confused. They might say, I feel like something's about to happen to me. Some people see a color or a ring of light right before the uncontrolled and jerky movements, falling over, staring, loss of consciousness or awareness, strange sensations or emotions, and uncontrollable jerking movements. Okay, this is a type of seizure that we are less familiar with. A focal impaired awareness seizure. So remember, a focal seizure is a seizure that's happening in one area of the brain. So these seizures usually start in one part of the brain cells, usually in the front, the temporal lobe or the temporal lobe or the frontal lobe of the brain. And so focal seizures usually involved involuntary movements. And so, rubbing, tics, lip smacking, chewing movements. People might look like they're trying to say something, but no sound's coming out. Hair twirling. You might see a bicycling movement of the legs or a pelvic thrust or some kind of other complex movement if that electrical stimulation is in the frontal lobe where it controls the movements. Sometimes a student will have an aura, and sometimes they won't with these types of seizures. They usually will seem conscious. They'll have their eyes open, but they will be staring. And so if you're trying to talk to them, they would not be able to respond to you, although they may be making sounds or even sometimes parroting a phrase. They might only have partial awareness rather than complete absence. So they might be able to respond a little bit, but not completely, but still have a decreased awareness of themselves or of the environment. And with some people, it can make them kind of frozen, like unable to move. All right, so some focal impaired awareness are called complex partial, which means that they move. I'm sorry. Here we go. They move from the focal part, from one part of the brain, and then they develop some complexity. They move to a different part of the brain while the seizure is happening. Usually, focal impaired awareness seizures last between 30 seconds and 3 minutes. And afterwards, the person might be confused 15 minutes to 30 minutes to an hour. So you may or may not see that super defined post-ictal phase where that person is very clearly not themselves, depending on how much awareness they lost during the seizure. They may kind of seem there, but not quite their full energy like you would normally see. Okay. Now we have something called a typical absent seizure. This is one of the most common types of seizures with our kids who have a diagnosis of epilepsy. The person will stop all activity suddenly, like a light has just been flipped off. They look like they're staring into space or just be blank. The eyelids might turn upward, the eyelids might flutter. And these seizures tend to last about 10 seconds. And so these ones are tricky because they can happen at any time. It might be during a school day, during an activity that you're doing with one of the students, and they might seem there a second and then not there a second. And it might be so fast that we might not even notice it. And then we have something called an atypical absent seizures because they might be a little bit longer and have a slower onset and offset and just have slightly different symptoms. It might slowly go into being absent and having that blank look and then kind of changing the muscle tone and movement. And then they might be doing some of the lip smacking or rubbing fingers together or making hand motions. And then these ones last a little bit longer they might be 20 seconds or more. So these ones we might actually notice a little bit more. Those are the 4 seizures that I'm going to go over today. There are other seizures. There are different combinations of a lot of the other signs or symptoms of seizures that I've just talked about. Um, so, the important thing that I want each of you guys to know is that when we're talking about seizures, there are a lot of different ways that that could look. It might be temporary confusion, it might be a staring spell, it might be uncontrolled jerky movements, it might be like falling down suddenly with or without loss of consciousness. There might also be just those cognitive and emotional symptoms like fear or anxiety or staring off into space. So it may not always look like those big tonic clonic ones that you have seen on TV or heard about when you hear somebody describe a really big, scary seizure. All right. So, how do we as school staff observe a seizure? Well, first of all, and we're not going to ask anybody who is a school staff to administer medications in the case of a seizure. A few of our students have emergency medication. They have a medication called Diastat. Some of our other students have had other types of medications that either go in the side of the mouth or under the tongue. But only a registered nurse or a licensed practitioner, licensed practical nurse would be administering those medications in school. Okay, so let's just say you're with one of our students, they have a seizure, or you think they might be having a seizure. You may not know. If you're alone, the first thing to do is call for help. Okay, you need to have somebody else with you, you need a buddy. So call for help. If you know you're going to be working with a student and you're going to be working with them one-on-one and they have a seizure disorder, make sure you have a walkie-talkie with you. If no walkie-talkie is available, make sure you have a phone that has cell service in the part of the school building where you are going, and make sure you're able to contact a nurse, okay? All right, so if you're alone, you call for help. A second thing that's important is to keep track of time. Time tends to go either really fast or really slow when you're in the middle of an emergency. So it's best if you have a phone or some other timekeeping device and you can flip on your stopwatch really quickly. If you don't have any timekeeping device, try to count out loud. Just say 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And just a reminder, if you're alone, then I want you to be calling for help rather than counting out loud. Okay, most important thing to me is that you are calling for help. But saying things out loud does help to orient you, the person, to time and place and helps kind of put you back on the ground, put you back in that situation. All right, another important thing, all of these things are kind of happening all on top of each other. Make sure there's nothing around their neck or constricting their breathing. So necklaces, chewies, um, hoodie ties, if they're wearing a harness or if they're in a stroller, then those straps, anything that's near the head or the neck needs to be removed from them so that they don't contort and accidentally constrict their airway. If this student has lost control over their arms and legs, if they have lost complete muscle control, then we are laying them down on the floor, positioning them on their side. We're moving all the furniture away from them. At the same time, we've called for help, right? And not only are we calling for help from a staff, but we're calling for a nursing assessment because the nurses are the ones who are going to be able to assess if this student needs emergency care and or medications. All right, so if the student's laying down on the floor, we've made sure nothing around their neck, nothing constricting them. They're laying down on their side. That protects their airway and keeps their tongue from falling back into the back of their throat. And you can't hold a student down or restrain them. You can hold something underneath their head, but don't hold shoulders, don't hold heads, don't put anything in their mouth. That's not helpful. And then you're going to stay with that student until they regain consciousness or until somebody else comes and says, I'm here, you know, you move along. If you're somebody who's not great in emergency situations and you know you probably need to be excused to go, help move students out of the room or do something else, let somebody know, hey, I need to be excused. I can't be in here. Please use your words and advocate for yourself in those situations. If you are the only person with that student, you're not leaving that student until they gain consciousness. Um, and then you're trying to keep track of any observations. What were they doing before? What are they doing during? What happens after the seizure? And then any seizure that's 5 minutes or more, we are calling emergency medical services. You have to dial out, press the number 9 before we dial 911. Okay. And we have to request advanced life support and let them know we have a student who has a seizure who needs to be transported to the nearest emergency room. If we have a student who has never had a seizure before and they have a seizure at school, and we know it's a seizure because they lost consciousness and there was that big jerking of the arms and the legs, then we also have to call 911 and transport them to the nearest emergency room. Okay. And then one of our students' seizure plan says that 911 needs to be called for a seizure greater than 3 minutes. So when we review all of those students together as classroom groups, we'll go over who the students are and when to call for what and who has emergency medications. All right, so here is some seizure first aid. Remember, don't panic, call for help. Turn the child on their side, start timing the seizure, stay with them, do not restrain. You're putting something soft under their head. We're not putting anything in their mouth. We're calling 911 if a seizure lasts longer than 5 minutes. It's just a helpful graphic. Okay, and then here are some helpful things for somebody who is having a seizure, right? When would we be calling 911? If somebody has a seizure without a documented history, um, students who have diabetes could have seizures. Somebody with an electrolyte balance could have a seizure. If there was an undiagnosed neurological condition that suddenly surfaces, they could have a seizure. So anybody here who has, without a documented history, has one, we are going to be calling 911. If you see seizures happening one after another with no break in between, we're going to be calling 911. If the person says, I need to see the doctor, we're going to be calling 911. The seizures last longer than 5 minutes, seizures occurring closer together than is normal, or if we are seeing signs that they're having trouble breathing, like that blueness to their face, or like a choking, or a change to the appearance of their breathing. Um, Also, anytime that nursing care is not available, should there be under any circumstances a time when a nurse is not available to you, then we would have to also call 911 because we need that student to be seen by a medical provider that same day, that same time. All right, so I'm going to come through each classroom and answer some questions and talk about different seizure plans that we have on file in the health office. And I thank you guys for watching this, and I will see you in person very soon. Okay, bye.